Hello and welcome to the Maine Immunization Program's webinar on National Provider Identifier Roster Billing Setup. If your facility has been approved to utilize the mass immunization function of ImmPact 2 to conduct clinics, you may also choose to allow the state of Maine to roster bill for those MaineCare clients. My name is Jessica, and during this webinar, I will walk you through the basics of the NPI billing setup, showing you multiple billing scenarios that your facility may fall under. I will also show you some errors that you may receive and how to correct these. We're going to begin by logging on to the Maine Immunization Program's registry, ImmPact 2. You'll want to type in your organization code, your username, and your password, and click the Login button. This will bring us to the home page of ImmPact 2. You'll notice on the left-hand side of the screen there is a blue menu bar. This menu bar has a variety of options based on your role in the practice. For this demonstration, we will be clicking on the NPI Agency Setup link located under the Manage Operations heading. This brings us to the NPI Service Agency Billing Setup screen. You'll notice at the top of the page there is some guidance. I will be covering this during this webinar. For the purposes of roster billing, the Maine Immunization Program has allowed mass immunization sites to enter billing information for both seasons and events. A season, such as an influenza season, may span for several months, while an event will be a one-day occurrence. Many schools are choosing to utilize an external vendor to conduct their immunization clinics. Other schools are choosing to have MIP providers store their vaccines on an off-site location. I'm going to be talking to you about these different setups, but you must keep in mind if you wish to roster bill, you will need to have NPI numbers for your school clinic sites, your vendors, and those inventory facilities housing your vaccines. Only those logged into the school profile will be able to input these NPIs into ImmPact 2. For the first scenario, I'm going to enter information on a school who is signed up to be an MIP provider. This means that not only will they be housing their own inventory, but they will be administering their own vaccines. We're going to start by entering the NPI number into the seasons. This site is going to be conducting multiple clinics over the influenza season. So instead of putting a one-time clinic event in, we will put in the entire influenza season. The NPI number is a 10-digit number. You can obtain this from CMS. Also, the NPI number will have a 3-digit sub-identifier. These are obtained from the MaineCare State of Maine office. We will be showing you contact information for both CMS and for MaineCare at the end of this webinar. You will type in your NPI number with your modifier under the NPI number box. The type will either be administration, inventory, or both. And in this case, since the school will not only be administering, but they will be housing, we are going to pick both under the type. Start date will be the start of your influenza season. The end date will be the end of your influenza season. For this demonstration purposes, I'm going to pick the 30th of the month. Once you are done inputting your criteria, you'll want to click on the Add button. You'll notice at the top of the screen, you'll get a message saying the season has been saved. If we scroll down to the bottom, you can see under the seasons, we do have a new record. It says MSAD 54 North Elementary School, located in Skowhegan, for the days of November 12th through the end of the month, has a scheduled season to administer and to provide inventory for school clinics. So any school clinics that the North Elementary School conduct between the 12th and the 30th will be covered under this record. You can click on the Show Legend box, and you can see that the blues mean MSAD 54 with the NPI number here. The second scenario I'm going to cover is a school provider that has signed an MOA with a Maine immunization provider in the area. For this purpose, I'm going to have the North Elementary School be administering their own vaccines, but they're going to have a provider off-site housing their vaccines. So I'm going to delete this record because it shows both. Click on the delete button. You'll notice at the top you'll get a message saying the season has been deleted, and it currently says no seasons exist for the site. The NPI number, I'm going to put in the same number for the elementary school. They will be administering the vaccines. The start date, the end date. Once you are finished, click the Add button. You'll see that now the North Elementary School is listed for administration of vaccines for the dates we've chosen. I'm going to add a second NPI. And this one will be for inventory. We'll enter our start dates and our end dates and click the Add button. So now you can see that the elementary school will be administering the vaccines. Skowhegan Family Medicine will be providing the inventory for those dates, and you can see down here on your calendar that it is clearly shown for administration MSAD 54 and for the inventory for the clinic Skowhegan Family Medicine. The third scenario I'm going to show you is if for some reason your clinic is using another inventory source during your season. Let's say that you have a large population of kids scheduled for one clinic, and the provider that is normally supplying your vaccines for that month, they do not have enough inventory to cover it. Before you have your clinic, you'll need to make sure that you call the Maine Immunization Program. We will have to make that change at our end so that when you enter administration records for the children, that it does not take away from the inventory for the practice that you are normally having supply your inventory. Because this is done in a one-time event, we will be utilizing the events recording down here. So the NPI number I'm going to enter. Again, this will be for inventory only. I'm going to choose a date and click the Add button. You will get the message saying the event has been saved. If we scroll down here, you can see that the inventory supply for the 19th has changed. So again, North Elementary School is administering vaccines. Skowhegan Family Medicine is supplying the inventory. However, on the one day, the 19th, Reddington Fairview General Hospital will be supplying the inventory. This can be done the same way for administration. So let's say on the 26th of the month, you are not going to have enough staff to do the administration, and you've decided to have another outside source come in and do the administration. Because it is a one-time event, we will use the events recording. We will put in that vendor's NPI number. We will be using administration, putting in the date, click the Add button. It says the event has been saved. And you can see that the inventory or the administration on the 26th is now being done by the Town of Carmel Ambulance Service Administration for November 26th. So to reiterate, you can change your administration or your inventory at any time to allow others to come in and supply the inventory or to do the administration. But please remember, if there is a change in who is providing inventory for your clinic, you must call the Maine Immunization Program before the date of that event. I'm going to show you an error that you may receive. If you are utilizing the seasons, you may only have one NPI for administration and one NPI for inventory on any one day. We have the elementary school listed for administration, Skowhegan family listed for inventory. I'm going to add the elementary school in for inventory as well to show you the error that you may receive. Click the Add button, and you'll notice at the top you will get a warning saying a season of that type already exists within the date range specified. See NPI number. So it will give you the NPI number that is interfering with your season that you're trying to input. The final scenario that I'm going to show you is if an external vendor is coming in to do both your inventory and your administration of vaccines. I'm going to delete all the previous records we've been assigned. Again, it is very simple to delete or to add a season or event. The external vendor that I'm choosing is Maine General. Maine General is conducting all of the clinics for all of the schools in the Augusta, Kennebec area. So if you are a school in that area and Maine General is coming in to do both of your clinics, both the administration and the inventory, you'll type in their NPI number, click both, you'll put in the start date and the end date for your season, and click the Add button. It says the season has been saved, and you can see down here that we have Maine General Medical Center listed to cover both inventory and administration for the month. The Maine CDC and Offices of Maine Care Services is anticipating to run monthly billings beginning in December, and these should continue throughout the end of the season on a monthly basis. This concludes the Maine Immunization Program's webinar on National Provider Identifier Billing Setup, and I'd like to thank you for watching.